Niamh is the founder of Peninsular Endermologie on Victoria's Mornington Peninsula and is recognised for her evidence-based, client-centred approach to body, skin and lymphatic health.
With a background in clinical nursing and senior roles in healthcare and cosmetic medical communications, Niamh brings a rare blend of medical insight, critical thinking and hands-on therapeutic experience to her work. She was first introduced to LPG endermology while working in London in the late 1990s, an experience that shaped her long commitment to the technology.
Since establishing Peninsular Endermologie in 2016, Niamh has developed a specialist practice using the Cellu M6 Medical Alliance system, supporting clients with lymphatic congestion, lipedema management, post-surgical recovery, cellulite, and connective tissue conditions.
Alongside her clinical work, Niamh contributes to professional education within the aesthetics and wellness space and regularly speaks on lymphatic health, body image, and ethical, non-invasive treatment approaches.
Your hosts, Shell
and Tiana, and today our special guest is Niamh. Welcome, Niamh. Thank you for joining us.
Well, thank you for having me, Shell and Tiana. I am big fans. I've been tuning in for ages, and I am very excited about being here.
Oh, so are we.
Yeah, we're excited to have you. So, Niamh, can you tell us about your professional background and how your work evolved into what it is today?
Sure. It's a bit of a winding road. So I started when I finished high school. I went straight into nursing and graduated as a general nurse and spent about 6 years in general practice, working here, there and everywhere. And then I ended up accidentally kind of falling into cosmetic surgery nursing. So I had a friend who was working in the Caribbean, called me one day and said, can you come across? And my initial thought was like, well, that's not really proper nursing, but it is the Caribbean. So went across, spent 5 months over there working under two really great cosmetic surgery doctors, plastic surgeons, and absolutely loved it. Quality of care was amazing. Patients were getting beautiful results. It was a lovely environment. Nobody was very sick. And so I came back to London where I was practicing, and I just thought, this is what I want to do. So went and got a job for the Harley Medical Company, or the Harley Medical Group, which was a big kind of large-scale cosmetic service provider in London. And we used to do lots of different hands-on treatments as well as helping people pre- and post-operatively for cosmetic surgeries. And so that is where I first came across endermology. So that was the late 90s, early 2000s. I just turned 54 today, so it's a long time ago now. And
wait, is it your birthday today?
It's my birthday today.
Oh, happy birthday!
Oh my gosh, I'm so sorry we're making you do a podcast on your birthday.
No, I love it. As I said before we started, I was like, I feel like we're friends already because I've been listening to you.
That's so wonderful. You don't look 50, you look incredible. Everybody get on what she's getting on.
I got a lovely ring light to just kind of just make things look a little bit better today. So
it's working for you, Niamh.
Thank you. I'm carrying it everywhere with me now. Did that, was in Harley Medical Group for about 4 years, and when they brought endermology technology in, we were using it really just to treat cellulite. So they just said, hands up, who wants to be trained in endermology? And I am like, yes, please, because I've always had a little bit of an issue with my legs. And so myself and another couple of nurses trained, and I loved it right from the get-go. I was seeing results with people. It's a really natural treatment. There's no side effects. It was really safe and easy to do. So I fell in love with endermology there. But then I ended up thinking, I'm getting a bit tired of this. And so I ended up actually leaving nursing and across to the dark side. I went into medical communications, medical advertising for 10 years. So did some great work there, came over to Melbourne 20 years ago and launched Gardasil, the cervical cancer vaccine here in Australia. And so that was brilliant. But then finished work when my kids were a little bit younger. And 10 years ago, I was thinking about needing to get back into a career. And it's a long story short, but I ended up having an argument with my husband, which resulted in me buying an endermology machine to treat myself.
Fabulous.
And I had the upper hand, and I made a decision. And so had no intention of starting a business at the time, but that was 10 years ago, and I've been working full time with endermology since then. So It was a very circuitous route, and there was no great plan, but here we are, and I love it, and I absolutely love my days now. So running my own business, working mostly with women, a lot of aesthetic concerns, but also more and more people now coming to see me with health issues too.
Wow.
Okay. So how did you come to learn of lipedema, and what made you start paying close attention to it in your clinical work?
That is a great question. And I have been racking my brain to try and think, when was the first time I really acknowledged lipedema? And it doesn't feel like there was an aha moment ever. So I think the term, when I first heard it, made sense to me because, I'm used to dealing with liposuction. So I think lipofat and then edema, swelling. So I kind of think that I feel like it was there in the background for a long time. But it's probably in the last 10 years since I've been running my endermology practice that I started seeing more and more people presenting and kind of going, this could be lipedema. I have to admit, my bias was that it was always presented with obesity. And so I always kind of joined the two of them together in my head. And it's really, I think I had the aha moment, hang on a minute, this is what early lipedema looks like, when I had a friend who came to see me who we had nursed together in London, and she was coming to see me for entomology, and she came in and she said, I think I've got lipedema. And I looked at her and I thought, well, I don't think you do, because if you do, that means I do, and I don't. That's not right, is it? So after that, I started doing a little bit more investigating, and I am a bit of a researcher, so I love my research and I love getting my facts and figures. So did the research, started learning a lot more about it. I have to admit, I've learned a lot from forums like yours, where we're talking to the people who report the early symptoms. And that has been amazing for me. So I think it's in the last maybe 6-7 years that I've acknowledging lipedema as a condition in the earlier stages. And now when people come to see me, because I get a lot of women coming in saying, oh, I don't like how my legs look, or, I've got my mum's knees. That was what I used to say. Or, I've got really bad cellulite. And I would look at them and kind of go, actually, it's a possibility that there might be something else going on here.
So Niamh, because you worked in endermology like years ago as well, and like you said, it was more like for a cellulite type thing, like women would come to you because of cellulite, and you'd use endermology. What in your clinical what am I trying to say here? What's the difference for you?
Yes.
Between cellulite and lipedema.
For you with,
That's a brilliant question, right? And a lot of people don't know the answer, and I'm still learning myself, really. So, because I do remember a woman in the early days when I was doing entomology. I'd probably been practicing for about 12 months. And this lady came into me with, I thought, really advanced cellulite. With cellulite, we have different stages, different classifications. So there's stage 0, where there's very, very little cellulite visible at all, even when you're pinching it. Stage 1 is when you can see the cellulite when you're pinching your skin. So that's kind of teenage years. Stage 2 is when you can see the cellulite when you're standing up and there's a kind of gravitational pull, but when you lie down, it all looks lovely and smooth again. And stage 3 is where you can see the cellulite when you're standing up and lying down. So it's visible underneath the surface of the skin, even with no pressure. I would argue that there should be another stage, which is fibrotic cellulite, because I definitely see people who come in who the cellulite's been there for a long time. It's built up some of that protein in the tissue, and there's more fibrosis and stubborn cellulite there. And so for years, I used to think I am seeing a lot of people with, deeply dense fibrotic cellulite. Now when people come in, I will look at other things. I will look to see if there are other signs perhaps of lipedema, so that it's not just cellulite. And that's where the biggest learning has been for me in the last kind of 6-7 years. So we have the other tells with lipedema, like little, fat pads around the knees. Sometimes it extends below into the lower leg. That's not really typical with cellulite. The comfort level, most people who come in with a normal, typical presenting cellulite aren't usually very sensitive in their skin, but somebody with lipedema is usually much more sensitive, so we'll use different settings on their skin too. And sometimes it's the shape of the person. And I was going to say, I remember a woman coming to see me when I first started doing cellulite and our endermology treatments in London. And she had quite significant, I thought at the time, cellulite. And that, you know, I hate the term, but the saddlebag appearance with a lot of excess fat in the thigh area. And when I was having the consultation with her, recommended her for liposuction. And she didn't want to go down the surgical route. And I just said, look, we can try endermology, but I can't guarantee we're going to get a fantastic result, but we'll just see where we go with it. And I think I remember her because she paid for 2 courses in advance. And that made me nervous because I thought, okay, I really got to deliver here. But she, and I think, you know, now I look back and I think she was probably at that stage. I mean, I thought she was older then, but she's probably as old as I am now. So she was probably at that stage where she would have tried anything because she had tried so many things before and she was a bit desperate. And we got amazing results then. So I was just thinking, okay, this is really great for that. Now looking back, I wish I'd known it was probably lipedema.
Yeah. So now, like when someone comes to Peninsula Endermology and you suspect lipedema, like how do you approach their care?
So look, I'm a practical person. So I will start by saying, you know, have you thought that there might be something else involved? I will ask lots of questions about symptoms. So I'm not in a position to diagnose somebody. If I think somebody has lipedema, then I'll have a conversation. More and more people now have heard the name. So I think, you know, the work that you're doing and the work that a lot of people are doing, it is becoming, you know, a little bit more of an awareness. If I mention, I'm a bit careful, you know, I don't want to just throw the word and kind of immediately create a condition for somebody who's walking in with something else. But if there are a lot of other symptoms, then sometimes it's just really nice. Somebody will kind of go, you know, I might ask about pain or I might ask about the heaviness, and some people kind of go, yeah, I didn't really connect all of that because they're quite often coming to see me. They'll have Googled cellulite treatment. They're coming to see me for something that's like a beauty or aesthetic concern. So when we start looking at all of the other things in relation to it, it's actually really nice for them to be heard sometimes. So then if I feel like it's appropriate, then I might mention the word lipedema to them. We have a great clinic down the road from me, the Mornington Lymphedema Clinic, so I can refer them down there. They will be able to help with compression, etc. And then we can have a little look and see and I use endermology as an adjunct treatment to all of the other medical treatments that are available to them.
Myself, what is endermology and how is it actually done?
Okay, great. So endermology, the word itself is French. It means through the dermis or through the skin. And it has been around for 40 years, this technology. We're having the 40th year anniversary or birthday celebration this year. And it began as a treatment for scar tissue. So the guy who invented it because he was having a lot of manual physiotherapy and he wanted to try and replicate that using a technology that was going to be more efficient than humans. And so it started as a treatment for scars, and it probably for the first 8 to 10 years was a treatment for scar tissue alone. And then they started looking at other connective tissue disorders, and some bright spark in the company at one point must have suggested cellulite. And so around 8 to 10 years into its lifespan, they started treating cellulite. They did some clinical studies, saw that it got great results, and then it became very popular across the world. But over the last 40 years, so I started working with, as I said, you know, nearly 30 years ago now. So back then it was mostly cellulite. We used to do some scar treatments, but now there is a huge host of different applications that we can use it for. So the latest machine has got a lipedema protocol in it. There's also, so it's fantastic. And because it works basically on the principle of negative pressure massage. So it gently lifts the skin and it rolls it between 2 rollers, or a roller and a flap. And so you get a lovely massage effect that mimics hands, but does it with more intensity. And it doesn't push down into the tissues. So it's really great. I have a lot of people come to see me with fibromyalgia and other chronic pain conditions. They really don't like a hands-on massage with pressure, but they love endermology because it's lifting the skin and it just helps to kind of get everything moving without that deep intensity that you get with a hands-on massage.
Wow.
So beautiful. And there's a lot of data. So we've got currently over 175 clinical trials proving efficacy across lots of different areas. So it's a great treatment for lymphedema. We have lots of studies showing how effective it is after secondary, with secondary lymphedema, after a mastectomy, for example. And it's great for muscle recovery, pre and post-operatively. So it does a whole host of things. It's one of those machines I could talk about forever because there's a lot to talk about. But with people with lipedema, it's beautiful. It will depend on the sensitivity. We know that people with lipedema usually have more sensitivity in the tissues. So we start off really quite gently with that. But after a few sessions, because we're already breaking down a lot of the fibrosis in the tissues, it becomes far more tolerable. And with endermology, you get a 300% increase in lymphatic drainage through those tissues. So it's significant boost in lymphatic drainage. It also boosts your blood circulation. So you get that beautiful circulation with the oxygen and nutrients delivered to the skin. So it makes the skin healthier. And it also helps to kind of boost your collagen and your elastin and your hyaluronic acid in your skin. So you actually end up with better skin tone and firmer skin. So it kind of tackles lipedema from all angles. So you feel much better. You feel lovely and light after the treatment because of that lymphatic boost that you get. And you also start to see the changes in your skin within the first few treatments with that reduced lumpiness and reduced density and hardness through the tissues. And then after some more sessions, you really start to see your skin firming up and looking smoother. So
wow.
Beautiful.
I love it. I did a
I was
course
gonna
of endermology and I absolutely loved it. But Niamh, you didn't talk about the funky white stocking suit you got to try and put yourself into so that the machine runs nicely over your skin. You wear
that's
this
right.
mesh, sexy white suit.
You described that beautifully. That's exactly that's exactly it. So the body stocking, I tell everybody you're gonna love it. Everybody looks at it the first time because it feels like a pair of tights. So when you open it up, it looks tiny and people go, I'm not getting into that. And I'm like, trust me. And the idea is just that it's so because there are little gaps between the rollers, and sometimes if your skin's a little bit sticky, it might pull. So the idea is that it just helps to allows it to glide across the skin nice and smoothly. And so you're not getting any pinching or pulling on the skin. And but it also gives people a sense of comfort.
See the most meaningful benefits for people with lipedema specifically who use endermology as part of their support plan?
Look, endermology is beautiful, and I love that you said it's part of the support plan because I don't think any one thing is going to help people. I think that the more awareness there is of treatments like endermology and that it's going to benefit lipedema, I think that's going to help potentially with funding because there's lipedema is an expensive condition to have when you're looking at everything that you need to do to manage it, and so it is another tool in the pocket for people. It works beautifully to support every aspect of lipedema in terms of the heaviness, the fluid, the skin quality, preventing that kind of the progression of the condition. So if you're managing it in that way with compression, with vibration, whatever other tools you're using, it's a lovely part of the package.
What about times where endermology might not be appropriate, or when you guide someone towards a different option?
Yes, so there are contraindications to treatment. So if somebody comes in and their skin quality is not fantastic, if there's any open wounds or if the skin is really fine and likely to tear with any kind of, more of a vigorous treatment, then I would recommend them for a manual lymphatic drainage instead. There are other things if somebody's got an active condition that they're managing or an illness or a disease that they're managing like cancer, then I'm cautious with that. It's not a no, but I would just probably be targeting a specific area of the body as opposed to doing a full body treatment. I know we get less impressive results with people with diabetes, so we'd had that conversation. I get people to fill in quite a thorough medical form before they come to see me. And if there's anything there that I think is a hard no, I'll give them a buzz and just recommend them to look at another route. And I'm very much part of, I really feel like a part of my role is education. So I really try to support people in making a decision that's best for them. So it might not be endermology, it might be compression, and really consistency is key when you're managing the condition. So anything that you can do that you find that you enjoy, that's easy, that's affordable, then that's what you should be doing. So there are barriers in terms of costs and in time, but for a lot of people, myself included, once you start with endermology, it does get a bit addictive because it feels lovely. It really supports your condition. It starts to make things look better too. So for a lot of people who start with lipedema, they always try to make sure that they can kind of keep that going for as long as they can.
How often do you get in the machine?
Well, look, it used to be every day. Well, with the body treatment, we said leave at least a day in between treatments. So when I bought it for myself, of course, I was in my room every night doing a little bit. But, you know, after 10 years of looking after other people, I have started getting a little bit slack. So I made a commitment to myself at the beginning of this year that I was going to do it at least once a fortnight. And I started off really well. And now I'm down to about once a month, which isn't enough. But again, I'm really hoping that I will be getting my hands on the latest iteration of the machine soon. And that looks like it's going to be a little bit easier for me to use on myself because I find it really easy treating other people. You know, it's kind of second nature to me. Treating myself is not pretty. I get myself into all.
Really?
I'm like, I lock the door before anybody is going to come into this room because, you know, I have to get myself into all kinds of positions to get to the bits that I want to get to. So, so I'm hoping the new handpiece looks smaller and lighter, and I think, okay, that I'll be able to do myself a little bit more. So in an ideal world, I would be treating myself, you know, get myself to a place I'm feeling nice again and the skin's looking really good. And then once every 3 weeks would be perfect.
That's awesome.
Love that. Yep. Amazing. Well, we have come to the end of our episode. So really important question for our community is where can the Lipoedema community find you?
Oh, so my business is called Peninsula Endermologie. So I'm in Mount Eliza on the Mornington Peninsula in Victoria. I have a website which is called Peninsula Endermologie, and endermologie is ENDERMOLOGIE. It's French, so it's a long word. And I also am on the socials on...
This episode is proudly sponsored by Morpheus Publishing, helping people with lived experience turn their stories into powerful published books that inspire, educate, and create change.
Visit www.morpheuspublishing.com.au for more information.
Lipoedema and its symptoms vary from individual to individual. The opinions and advice voiced in this podcast are of a personal nature and used for educational purposes.
Please take away from this podcast what resonates with you, and please see your GP or preferred specialist for diagnosis and healthcare. We are Shelley and Tiana from the Lipoedema Podcast. Until our next episode, bye for now.